Do you know the 6 important components of the heart? Well, most of us might know that the heart is a muscle in general. But what about the valves, the arteries, and the veins? And last but not least, could you exactly explain what the pericardium is made of? I'm Joseph Alpert, and I'll be your lecturer for this online course. I started my educational career at Yale University and obtained my medical doctorate from the Harvard Medical School. Today, I'm professor of medicine at the University of Arizona College of Medicine in the United States and editor-in-chief of the American Journal of Medicine. Within my course, you'll learn all essential knowledge about cardiology on 2 levels, a basic level and an intermediate one. On the basic level, we'll cover the heart's anatomy and understand the way the normal cardiovascular system works. By knowing this, you will be able to understand the methods for detecting abnormalities and strategies for treating cardiac diseases. Your success will be supported by Lecturio's adaptive learning platform. Additional questions and material for download will help you to consolidate your learning process. I promise you'll be able to answer the initial question about the pericardium and many, many more as well. At the end of this course, you'll have an excellent understanding of what cardiology stands for and what it can do. I am looking forward to working with you so that you'll feel certain about the major topics, terms, and clinical practice of cardiology. Welcome to my course. Hello, I'm Joseph Alpert, professor of medicine at the University of Arizona in the United States and also the editor-in-chief of the American Journal of Medicine. I'm going to be presenting a series of 14 lectures which are an introduction to cardiology. I hope none of you believe that you will be expert cardiologists at the end of listening to these 14, but I do believe that you will have a much greater understanding of cardiology. You will understand the various factors that lead to heart disease, you will understand how we make the diagnosis of heart disease, and you will understand the various therapies that we have at our hands that we can use in order to help the patient with heart disease. So let's start with something very basic. Let's start with the anatomy of the heart and the blood vessels. Now, many of you, of course, receive hearts when you receive letters from friends or close, intimate relations. At Valentine's Day, we see the heart, of course, the heart shape. Actually, the heart doesn't look anything like that. That's just a symbol for the heart. In fact, what you see here in this little diagram is a little bit more what the heart looks like. The heart is conical in shape with a rounded point, not a sharp point. And of course, it is a pump. It's a muscle pump that keeps the circulation continuously going in a circle. So what happens, of course, I think everybody knows, is the heart pumps the blood out full of oxygen and nutrients to the cells throughout the body, and then waste products are given to the blood. The blood returns to the lungs, a deep blue, and is then reoxygenated, gets oxygen again, and pumped out to the body. There's a continuous circle going on of the circulation. Here's a diagram that shows you how the heart lies in the chest. Notice that it's not directly in the center of the chest. In fact, it's slightly to the left. In this view, of course, it looks like it's to the right, but if you were standing behind this person, where the heart bulges out would be the left. And you can see 4 points are marked on this skeleton with the heart drawn behind it. Behind the ribs, of course, and the breastbone, which we call the sternum. You can see that there are 4 heart valves, and the points that are marked here are the places where we listen with our stethoscope when we want to hear that particular valve. So, and we're going to go over the names of the valves and where they're located, but just for introduction, you can see that they're the aortic valve, the pulmonic valve, the tricuspid valve, and the mitral valve.
Advanced Heart Center and Cardiology Unit, equipped with the latest techniques and cardiology treatments in field of cardiology at HC Marbella International Hospital.
Hello, I'm Dr. Bernd Reisbeck. I'm an interventional cardiologist working at Marbella High Care. I welcome you. The topic I want to talk today is about why do patients see a cardiologist? Most of the times it's because of chest pain. So the chest pain can have multiple reasons and everybody's afraid that this is cardiac in origin. In fact, sometimes it is and sometimes it's not. That makes it so difficult. It can be, if it's not cardiac, just like stomach pain from gastric ulcers. It could be just some benign muscular pain. But in most of the cases what we do is rule out that it's cardiac in origin because this is deathly. So what do? First of all, we get a thorough history, ask the patient about when did the pain come on, how long did it last, where did it radiate to, when does it occur. It's very important, and like and do they have history of heart disease in their family. So what we do then is we do a thorough exam, physical exam. We get an electrocardiogram to see if the electric system of the heart is working fine. Then we will do an echo of the heart. It's like looking in the car under the hood. We see if the motor, the heart, is intact, if the valves are okay, if the thickness of the heart is okay, and if the blood flow is going as we expect it to go. What is then the next thing? We do a stress test. So the stress test is sort of like the better ECG, and that's the most valuable and important test to see if the chest pain is cardiac in origin. You exercise, and there are different cases of exercise. It's on a treadmill or it's on a bicycle, and you basically get your heart rate up, and we will see how the heart reacts under stress. And if that's the case, we have to proceed and do further invasive tests, for example, a coronary angiogram.